if they don't make it, then so be it, but
And Tom will be sorely disappointed that he's put out of here at midnight.
will be. Everything good?
Yeah, we just have to go down that.
No, it's not for you till 7:45.
Cause she was gonna miss the healthcare debate
Right.
discussion presentation.
She's just arriving to Rochester right now.
Sweet. How are you?
Yep.
There's just too much going on. Let's just get there. Okay, it is 7:03. We'll call this meeting to order. We stand for the pledge, please. The pledge allegiance.
To the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, sound system all together and working? Got everyone in the room here? I think that is a yes. Okay. A motion to approve tonight's agenda. Yes, we'll have some adjustments for the agenda later. It's okay, right? I'm trying to stay at it. We're talking about that topic.
I will second.
Any discussion? All in favor, say aye.
Aye.
Any discussion? Any opposed? So.
Oh,
Public comments? Any public comment?
where's Gary?
I know.
Heck.
Gary's on vacation.
Oh,
Okay, seeing nobody coming forward. Move on. What's scheduled is the Municipal Health Consortium presentation, which was a very lengthy conversation. And it doesn't look like anybody is trying to join our meeting to present. Didn't hear from them all day, but I know the presenter was on vacation all last week. But she's got the links, so we'll have to, I guess I'll make a motion that we table that, and if she joins in, we will enter her in at the earliest convenient time.
Why don't we make a motion, or why don't we move it to after the Copperfield community discussion? That way, if they join, we can do it at the end of the meeting.
Okay. Okay, so the motion is to move the Municipal Health Consortium presentation to the end of the meeting.
Second.
All in favor, say aye.
Aye.
Opposed? So moved. Communications, town clerk.
We're consumed by the new software system in our office, so it's a lot of learning curve, takes everything a little longer. But it's gonna be good in the end, just get used to it. The monthly reports probably look a little different, and that's why I'm just working on a better way. So hopefully I'll get that by or the month after. And then I'm preparing for school taxes, and then by the time I see you guys again, I'll be full swing, so that's all I've got.
Awesome.
Right. Highway superintendent.
Good evening. Lot of county road work going in. There's some, we've completed some. We did run into a little glitch on Fountain Hill Road. There's a culvert that needs to be repaired. That's, right here is 60 Fountain Hill Road. It kind of caved in. So that's gonna get repaired tomorrow. Been working on Toby Road, Snow Road, and Pittsburgh. Been doing work for the town of Rush. New York State DOT is working on 251 from Rush through the four corners of Mendon. We see little update, year to date, got a couple of numbers here. For New York State work that we did for snow and ice removal, we're at $131,870. For Monroe County, snow and ice, year to date, $252,573. And road work, 238,810, so that's a total of. For both town and. Their county and state would get $622,000 when they have a revenue like that from those guys, so. We hope to keep on that track moving forward, so, and that's just year to date, we still have quite a bit more county work to do, so.
Fantastic.
We did, county work included like Maplewood Avenue and stuff like that. We're continuing with brush pickup, is, the weather, allows us to and everything else. There's speed limit signs, we did receive a couple of calls for the ones that we own. They weren't tripping until the vehicle hit 45 miles an hour, so it wasn't really, some people didn't think they were working. But we've changed the parameters on that. Sheriff's Department has put up a couple of portable speed limit signs too. I think there's one on West Main Street now. Keeler Construction, their Fountain Hill Road project is complete. It's not complete because we're just waiting to make sure the grass grows. We still have to fog seal and stripe Fountain Hill Road. Taylor Road, that project is moving on schedule. They removed the platform and the old wood footers and everything else. We have gotten quite a bit of build product out of that job that's gone to the back of Dreisbach Park, so. I mean, a lot of, so it's, but they're providing a bulldozer and they're bulldozing it all up and doing a good job. Miles Square Road sidewalks are supposed to start. We had a pre-construction meeting. That should be starting, I believe this week, unless somebody knows different, but. Play soccer fields, MRB is gonna do a site survey and set up some grade stakes on Wednesday. We've been doing we have our pricing pretty well lined up, for the dirt work for the soccer fields. Ken Zuger kind of backed out. He's got too much work, which I guess for him, that's a good thing. So we have gotten some other prices, from John Hastings and also from Peak, Property Services. We repaved Plains Road from the creek up to 251. That just needs to be striped. All the material that came out of milling on that job was repurposed and went to the Meadow Foundation. Couple of parking lots, just smoothed out. The salt brine machine that I talked about last month, we're still waiting for. We sent them a spec on what we were looking at. We could not have a final quote on that. We've been working on our budget. We are pretty close to where we have to be as far as capital expenditures and stuff like that. Anticipated costs, revenue. We are increasing some areas, for example, for fuel costs, salt expense and all that kind of stuff. So you're gonna see increases there, but as far as equipment purchases, that'll be down pretty significantly, I think, for next year. So our budget should be pretty much in line. So I was asked today about our .gov email addresses. The update on when we're gonna switch to that, or that came from Tom Fry from Monroe County, was asking for our mailing list. We were like one of 4 towns that hasn't updated it, but it's still, you think there's like an automatic
Yeah,
switch? or
it's actually
whatever?
done. Right, Danny?
If you send something to the .gov version of your news, put a dot in the end.
Okay,
It's just that something's out, it's still the .org. That's switchable whenever someone else is done.
okay, all right.
So,
I was just asking.
yeah, I should send out an email that tells everyone to start using the new format,
Okay,
but you won't lose the old format.
all right,
It'll still keep coming. It'll be another alias,
okay,
but it's basically Town of Mendon NY. .gov,
okay.
and I'll send an email out what the format is.
There was a rumor mill that started, I guess, last week about the money from the 250 year celebration, there was $25,000 that was in the budget. Somehow it got into the rumor mill that $25,000 was gonna come back to the highway department to buy fuel. So I know nothing about this, we're well within our budget parameters, but I don't know where the rumor started, I don't
Did
know.
you see?
I just wanna,
We would also prefer not to go to jail for breaking New York municipal finance law. So that is not in the plan, or that has not been discussed.
that rumor is out there, so I just wanna get that.
You heard it here
Were
first.
people happy about that? Were people like happy to hear that? Like, are they gonna be disappointed to learn that that's not happening?
I hope they're sincerely disappointed.
Yes, indeed.
So, yeah, I just wanna get that in the bud before it, So far, our highway budget is well in line, so that's all I got.
All right, thanks.
Thank you.
Pretty good. Appreciate it. Town engineer,
We continue to advance a number of projects, grant applications were submitted for the culvert, as well as stormwater on the sport. You heard about the Mile Square Road sidewalks, Madden Square Road retaining wall, we're working through this and that. And Red Box Park, to get all the fines and counts within, all consuming on the urgent care, so discussion of those. That's all I got.
town attorney will forego. Town board. Kim, would you like to go first, or?
I have nothing to report because we were just here 2 weeks ago. I did attend the Climate Smart Task Force, but I will defer to Rebecca on that, so you don't hear us twice. And then this week I will have lots to report after the next meeting, because every night this week I'm here.
Rebecca?
Okay, so, I attended the library monthly meeting on, August 3rd. I think my dates are always funny. But the library director and the entire board of trustees, really wanted to make sure that you understood, Joe, how grateful they are for all the work that you've done, representing their interests, listening, and negotiating with the village and the developers to really make improvements to the plan. So I'm sure that you've heard it from them, but I wanted to say it here as well, that they're very grateful for all the good work that you've done on that project. So
Couldn't do it with all of you, without all of you, the people in town
Well-
hall, so.
yeah, well, you've done a great job on it. I agree with them. There's a new library clerk in town, Julie Masterson Smith, who was the longtime Manor School librarian for decades. She retired and they hired her on at the library. So wonderful addition to their team. It was great to see her there. She was doing Julie Masterson Smith thing, and it was a great addition. They've started their well, they're pretty far along in their budget, so you should be seeing that pretty soon. Just modest increases for increases to cost of living, but they're on a good track there. They've also been thinking about several policies and thinking about how they can align their policies with ours. A couple that came up are disaster plan. They need a disaster plan, some sustainability policies, and they need an employee handbook as well. So thinking about how to align those things with us was on their mind. Then they're also updating their interlibrary system. I think that's what ILS stands for, which is a big change for them. So they'll be adjusting to that change. It's been one system, Carl, since 1992. So they're looking forward to that change. And then the Story Walk, they ordered their pedestals. There's a bit of uncertainty on installation. It seems unlikely that the Eagle Scouts can install it for a number of reasons, but they're planning a grand opening for that on October 17th. So lots going on at the library. I also attended the Farmers Aid event last weekend at White's Farm on Route 64. They had live music and chicken barbecue, raising money for farmers in need. So that was a nice event. I'm hopeful that they do more. I also met with Peter Carosa. He's the, what's the word? What is he?
He's the chair
The chair?
of the
Yeah.
That sounds like the wrong word. It's not though, I guess. He's the chair of the Climate Smart Communities Task Force. Thought it was a different word for some reason for Peter, on that one. He's the chair. We met and we went through all the actions in the Climate Smart Communities dashboard. I reconciled that with some of the work I did with Corey, and we were able to identify 18 actions that we think the town has probably completed or almost completed. And at our last task force meeting, we assigned members to those actions. And so we have people like off and running, gathering the documentation that's needed for those 18 actions, which totals to 96 points. So we need 120 to get to bronze. So we're sitting pretty good for that. I also reviewed the environmental report for the Urgent Care Center and identified some issues with that report, which I think we'll probably discuss later. And I also am working on a communications. So I had started a social media policy a couple of weeks ago and got some feedback on that. And as I was trying to incorporate the feedback, realized that what I was trying to write was something broader than a social media policy. It was more like a communications and public information governance structure. So that's growing. So hopefully by September, I'll have some language around a broader communications and public information policy. Okay.
Okay, Tom.
I attended the ZBA meeting on July 23rd. There was one application for an area variance for lot coverage over the 2% allowed. There was no decision. The public hearing was left open. Neighbors were objecting to the location. It's a ground mounted solar array. And the applicant's going to return to the next ZBA meeting with alternate locations, something that the neighbors will agree with. I attended a highway meeting on July 29th. We discussed DOT keeping the roadside along Clover Street clear, so we don't have any more issues with Stony Lonesome Road. We discussed the urgent care in regards to plowing and salting. We talked about adding 2 more speed monitor signs to 27 sign budget. Discussed a new storage building at the highway department, security systems, the roof on the youth center, the entrance steps and the ramp at the community center, retention pond maintenance, mowing and tree removal. And we discussed planting a tree in Drivesback Park in memory of Odie Bancer. Odie passed away a few years ago. Odie mowed Drivesback Park for years and he took a lot of pride in that, taking care of it. So we're looking at planting a tree in Odie's honor. And I also attended a public hearing on August 3rd for the urgent care.
The consortium are here.
Okay.
Shall we finish our communications and then
They
move
can
them
hear
again?
me. Can you hear me?
We're here.
That was quiet.
I could hear something.
We'll move on with communication.
Can you say something again with the consortium?
We're here. Good evening.
Hi.
Maybe,
Okay. So are you?
maybe we'll
Let's finish the
Should
communication.
have finished
If you're
communication.
gonna finish
Okay, we're
communication.
gonna put you on in about 5 minutes.
Okay, Tom, you're all set, Tanner?
Yeah, relatively quiet, as we were just here a couple weeks ago. I attended the planning board meeting. We had a couple applicants for subdivisions. And then the bulk of the conversation was around the Copperfield community that Hunting High Falls is looking at, that we will also discuss today. Led to some follow-up conversations between the planning board chair, Earl, and the town. I think the conversations went really well around some of the municipal facilities and usage. And then we'll talk quite a bit at length about it this evening. That's all I have. Thank you.
Sounds good. Okay, town supervisor, just 2 things I want to talk about tonight. One is I did write to the New York State Department of Transportation on Stony Lonesome Road. I'm touched on that. I explained to them that the clearing of the brush done both by the town of Mendon as well as the state has mitigated the safety hazard of car accidents in that intersection. And as the state always says, they like to keep roads open, so we're gonna keep the road open, and there's been no accidents there, so I think that the intervention that we've made has worked, and there's no need to spend 120,000. 88,000 of that would have been on the town. So for now, it's gonna be what we're doing going forward. And we're gonna see how it goes and watch it over time. The state has money planned for that intersection a few years from now. And it's a lot of money. So I don't know what they're planning to do with that money, but they do have it earmarked for that intersection. So we don't know if it's a traffic circle or what they're thinking, but we'll find out in 2030. Unless something changes that where we need to address that issue again. So the other thing is the big topic on one here's mind has been urgent care. We've devoted an enormous amount of time to that. It's a really big project, and bottom line is as Kim or as Rebecca mentioned, we have done a lot of work on that. Overall, I personally believe that this is a great project for our community. There's been some issues with getting information and material going back and forth, and Megan will address that when she arrives at 7:45. And overall, though, I want to say that I think this partnership for our community with the U of R is going to be great. I think there's a lot of advantages for us that we don't even know yet by being partnered up with the U of R Thompson. And I think we'll work through some of these details. It may not go exactly as everybody is hoping, but we're trying our best. So, and bottom line, we're looking out for the town of Mendon's best interests. That's our job here, so. Working with people and trying to make it all work. That's all I have. We're moving on to healthcare consortium presentation. I apologize to you for not getting the link to you. I thought I gave you the instructions, which probably were confusing, so I apologize.
Do we need to move it on the agenda again, or, okay?
I'll make a resolution to move a motion to make the healthcare consortium
Great.
meeting to right now.
It's number 8.
Number 8.
Second.
Okay, all in favor, say aye.
Aye.
Any opposed? Don't move. Okay, Elin, I'm sorry, Elin,
Thank you.
I know you're there. Oh, there's.
All right, can you hear me?
We can.
All right, great. Thank you so much, and sorry for coming on late. But just to, that's a great situation of how we utilize all our resources. We had Kylie emailing people, me texting people, calling my voicemail, making sure there wasn't something there. So we are a jack of all trades here, trying to solve all our problems, including healthcare situations. So what we thought we would do this evening, and thank you so much, Supervisor Alati, for inviting us to join you this evening and talk a little bit about something we're passionate about. And we thank you for your application, but because this is unique and different, we wanted to spend some time explaining the consortium to you, and should you sign the municipal cooperative agreement, what's accepted, what you're getting yourselves into. So the front part of the presentation is a little historical information on the consortium. Kylie's going to share her screen. I'll walk through kind of the history, what the consortium is all about, and then I'll turn it over to Kylie. We'll talk a little bit about the healthcare opportunities, healthcare plans that we have available to you and your municipality as a member of the consortium. Everything we're talking about tonight is for 2026. Our timeline is tomorrow. We will probably come up with a budget recommendation for next year that will go through committee and be voted on in September. So we've just started looking at the process after we've had a chance to look at 7 months of claims experience, looking at the trending in the marketplace. So we won't have any premium increases for next year yet, but we will vote on that September 4th. And our conversations are transparent throughout the process, so we can certainly discuss them as we know more as we go through things. So even though it just says my name on this opening slide, I brought with me this evening Kylie Rodriguez, our benefits manager. She's our expert when it comes to all our plans. And I thought if you wanted to ask questions, get to that part of the presentation, she'll be here to answer those questions for you. So I'll start with a little bit of our history. We were formed as a project for the Tompkins County Council of Government. They were looking for a solution to their premium increases at the time where they had no control over it. So one year it'd be a 5% increase. The next year it'd be a 25% increase. And small towns and municipalities were having a hard time balancing their budget. So they were looking for some type of rate stability. And when we formed, that was our main mission. It remains our mission today. We go about it in a couple different ways by having reserves in place, an unencumbered fund balance, and righting the ship when we need to right the ship. So our average increase since inception, we were formed in 2009, 2010, with new municipalities coming in 2011. Since inception, we've had a 7.3% average increase. For the last 10 years, it's been a 7.5 increase. And just like everybody else, the last 5 years have been pretty bumpy, and it's been an average of 10.3 over that 5-year period. So we are experiencing double digits like the rest of the market. But when we were formed, we wanted a high quality, cost stable health insurance solution. We had a vision statement that we would work with the municipalities, we'd work with our provider, other administrators, with providers and other representatives to come up with an across the board solution in health insurance. And do a lot of education specifically on personal health and getting people involved in maintaining a culture of health and an education of healthcare, especially preventative healthcare within their municipality. And that is part of our wellness program that we'll talk about just a little bit and a little bit later. So when the consortium started, first they were looking at, were they going to be a buying group? What would their structure look like? And they learned that the best way that they could control the risk was by becoming self-insured. So all the municipalities came together as one in one self-insured community. And filed under Article 47 of the New York State Insurance Law. There are only 12 of us within New York State. All of the others are school districts. We are the only one that is uniquely municipalities. Some may have a municipality or two as part of them, but we are 100% town, village, and some libraries or other municipal entities, and we're not governed by a school district. So we're self-funded. self-insured health insurance organization. You become owners of it when you become a member. So you're not buying insurance from an outside entity. You are the insurance company and you are participating in the risk pool. We do have to adhere to New York State mandates, even when we are writing our own benefit plans. Our benefit plans mirror those in the market because we want to be competitive and make sure we're offering the same benefits, especially for those who are like you coming from a community rated plan. We want to make sure we're comparing apples to apples and oranges to oranges. There are a few things that are required when you become part of the organization. One is you, the municipality, have to adopt our municipal cooperative agreement. And then anytime we make a change to it, including adding new members, you have to approve it again and sign it again as a governing board. When you sign your first MCA, you are signing that you will remain with us for 3 years. We are a long-term solution. We're not a year-to-year insurance buying solution. It's over the long term. So we like stability. Having municipalities jump in and out causes us concern for adverse selection. We must keep 2 reserves in place, a surplus reserve and an incurred but not reported. Every municipality, regardless of size, has their own seat on the board. So you would have a voting seat on the board. And there is a role of labor in the organization, and I'll talk about that a little bit later. And then there's a few things that are unique to us. If you're 65 plus, are eligible for Medicare and they're actively working, we still pay first. And if you have someone that is lucrative enough to afford COBRA for 36 months, our COBRA is eligible for 36 months, not 18. We don't have many people who take us up on that. So those are the rules and regulations of an Article 47 and what makes us unique. We started in Tompkins County. We then continued to grow to the 6 contiguous counties. We grew a little bit more. We added Livingston and Monroe in 2025. So we're really excited to be speaking with you this evening, kind of in our new frontier. So we're available in 18 counties. We don't have members in all 18 counties because we're still growing our membership into those new counties that have been added in 21 and 25. But of the total consortium, we have 87 municipal partners and we cover 8,500 covered lives. These are our municipal partners. Just because a county is listed at the top in bold, that doesn't mean they're a member. We're just organized by those counties where we have representatives. The 2 counties that we currently have as members is Seneca County and Tompkins County. How we're governed. So similar to a municipality, we are governed by a board of directors. Because we now have 87 municipal partners, it gets kind of unruly to have a board of directors meeting and get the participation every month or every other month, even quarterly. So the acting when the board is not in session has been delegated to an executive committee. The executive committee is voted on each year at our annual board meeting. And then reporting up to the executive committee are these other committees where all the action happens. For example, the finance committee starts working on the budget. Audit committee actually works on claims audits, not the financial audit. Well, that's the claims and appeals committee. The audit committee actually works on the consortium's annual audit. And then we have, other operations committee policies and procedures. The box down on the lower left, what makes us an efficient organization, we don't have a lot of staff and a lot of departments. We purchase consulting, actuarial, legal, finance, expertise, and ITS when we need it. So we do have relationships with professional support services, but we purchase them when we need it. Unlike an Excelis and a large insurance company that has all that stuff in-house, that's one of the ways we are able to be successful as an efficient organization. We do not adjudicate our claims or set up a provider network. We have outsourced that to Excelis. So we look very much like Excelis. Should you join us, your employees would get cards that look exactly like their Excelis cards, have all the Excelis information on it. But Excelis allows us to put our logo in a tiny, tiny font at the top of the card to show that we're actually a unique member organization just utilizing TPA services from Excelis. So we pay the claims, Excelis does not pay the claims, and we determine what the health plans are that Excelis pays off of. We ask each municipality to get involved in the organization, and you can get involved as much as you want or as little as is required. So we do require municipal representation on our board of directors. If you are an officer or a committee chair or asked to be an at-large member elected by the board annually, you would be required to attend the municipal, the executive committee meetings. Those actually meet monthly. And then, as required as part of DFS, we have a joint committee which is made up of both management and labor representatives. And that is a group that requires attendance, a quorum to take action. The joint committee looks at all plan changes before they actually happen, and any major changes within the organization that would affect a union agreement. It's discussed at the joint committee first. And then all the other committee representation is optional. But we ask you to get engaged. It's much better when our municipalities are engaged and can participate in any of the changes and make the consortium better for all municipalities. So the board of directors, we have an educational session on October 27th, which of course you are invited to attend. We can send you links to that. And then our mandatory board meeting is in person. We would invite, as our new members go through the process, we invite them to attend that with us. It is actually TBA, we have announced it's going to be at Greek Peak this year. And we do it at noon and provide lunch. The board asked for that to happen so people could get to the location and kind of multitask by eating lunch while going through the board agenda. At the board of directors meeting, we approve the annual budget, we approve the premium rates, we accept new members, we approve any new plan benefit design, including plans that change to be in compliance with the actuarial value. We elect the executive committee who represent us, all our officers. And then the board is responsible for our fiscal soundness, making sure we're prudent in our operations. And we really encourage our board of director members to communicate back to their municipalities, because it's you that owns the consortium, and we feel you should really be informed and engaged throughout the whole process. And as I said, right now our board is only meeting twice a year and has delegated all other responsibility to the executive committee. I think I went through most of this already, but we will send you a copy of the presentation so you can just see the definition of all the boards and committees. So I usually do this slide because Kylie doesn't like to talk about herself. So I'm probably going to turn it over to her shortly. But one of the things we pride ourselves on, and a lot of the positive feedback I always receive, is about our customer service. We have multi-levels of customer service, but we also deal with your employees' problem solving at a very individual level. And later in the presentation, there's a slide about benefit conversations getting very personal very quickly. We don't want your employees to come to a meeting and feel they have to raise their hand and say, hey, if we're switching to the consortium, is my drug XYZ going to be covered? Or I'm in the middle of this really private treatment and I don't want to discuss my wife's chronic condition in the front of this employee meeting. So that's why we have Kylie and her team will speak one-on-one even before your members about a transition. But once you become a member, there's several different customer service options. Excelis will answer your members' phone calls. We have an 800 number, 877 number that's specific to us with Excelis customer service reps that know your employees are part of a consortium and can answer questions within that context. If Excelis cannot answer simple questions, was this claim paid on this date? You know, and Excelis can't cover it, or they said it wasn't covered and they couldn't explain why. The next call or email can be to our benefits department. That then goes to Kylie or Jess, who then can handle it on an individual basis. So we have several different ways to contact customer service and get information. We also put a ton of information on our website. You would have your own webpage set up where employees could go and click and find out what plan they're on, find all the summary plan descriptions right there on our website. So access in many different ways. We will also talk to you about plan options, which we'll discuss a little bit tonight. But in the future, after 3 years, you think this plan isn't the best option for you, we'll do cost comparisons for you, talk about the difference between a co-pay plan and high deductible health plan. And then the most important part, and why I say Kylie is our magic bullet secret sauce. She's not only great at problem solving in the customer service arena, she also has a great Medicare background. So whether you're on a Medicare Advantage plan or a Medicare sub plan, or thinking about going to one or considering one, Kylie has a very broad background in that area and can be very resourceful when it comes to those kind of decisions. We actually had a retiree show up in the office today to meet with Kylie. Unfortunately, she wasn't in the office today, so he's coming back tomorrow. So a lot of retirees rely on Kylie and Jess specifically for Medicare-related information. And as I said, we have stuff on our website. We have trainings throughout the year. We were doing an educational session each month up through this month. So we try to arm you with as much information as possible. So I think I'm going to turn it over to Kylie here because this is her bailiwick and a program she has grown herself.
So I'm Kylie Rodriguez. I'm the benefits manager here at the consortium. So feel free to throw any insurance questions at me. I love them. But our wellness program is free to any of our members, our subscribers, and their dependents, because our goal is really to educate about healthy living. And we host challenges, we host monthly webinars. We just integrated monthly meditations this year, all voluntary. They're not mandated to do it, but it's an opportunity to educate about different topics that they may want to learn about when it comes to wellness, preventative health screenings, things like that. And we send out monthly emails to promote that involvement into the wellness program, and we encourage you to share those with your employees to get them engaged. And then we, of course, give out prizes for participation to try to drum up that participation. We also host Blue for You clinics in the spring every year. Blue for You, it's a free biometric screening where we can do it at locations close to our municipalities to get them to come and do their blood work. A lot of subscribers and their families may not get their annual blood work, so they don't realize that they're having some red flags for chronic conditions and things like that. So this is a great opportunity for them to get their blood work done for free, and it can be sent right to their doctor's office. We also promote other programs that Excellus has available that are free to our members, like Blue 365, WellFrame, MD Live, which is 24/7 access for acute care to a doctor, so they can write a script and you can go pick it up at the pharmacy, even if it's, on a Sunday afternoon. And then we also promote our wellness programs across our social media on Facebook and Instagram. Feel free to check it out. We update them almost daily. So just trying to encourage that awareness across our membership. So without further ado, right? So at this point, I'll take a pause just because Elin covered a lot about the consortium, just to make sure there were no questions about that before we kind of dive into talking about plans, benefits, costs, all of those things.
I think we're good.
Okay. All right. So before we dive into comparing our costs to your current plans, we just wanted to take a moment to compare our plans to the plans that are available right now in the Rochester region that are community rated. And as you can see, all of our current platinum, gold hybrid, gold plan, these are all of our metal level plans we offer, fall below what the current premium rates are in your area for community rated Excellus plans. And we just wanted to point that out, that we try to be as cost competitive as possible, while still offering a little bit richer benefit than most of the plans that we compare to when it comes to Excellus. And I'm not going to read you line for line on these numbers. I know you can read them, and we'll definitely send you the whole slide deck after to review as well. So before we dive into talking about health insurance, I always go to this slide. Some people know what all these terms are. That's great. Some people don't. And when we talk health insurance, if you don't know the terms, then I quickly lose people. So a deductible is the amount you have to pay before your insurance kicks in and starts paying on the claim. So for example, on our gold hybrid plan, we have a $1,200 deductible. Once that's met, coverage kicks in at an 80/20 benefit for some benefits. It's not applicable to all. We'll talk about that in a minute. There's also an out-of-pocket maximum. So every copay and co-insurance you pay throughout the year is going towards an out-of-pocket maximum. Once that's met, you have 100% coverage for the rest of the year. In-network and out-of-network are different buckets that accumulate separately. But a lot of times if someone's having a high medical need year, they may reach their maximum out of pocket and then have 100% for the rest of the year. We kind of look at that as the catastrophic amount. You're really sick, you meet that amount, you have 100%. Co-insurance is a percentage you pay for a service. So like an 80/20 plan means the plan pays 80% and the member pays 20%. Co-insurance, that's what a co-insurance is. Versus a copay, which is a set dollar amount you pay for a service. So for example, on our platinum plan, you go to your primary care doctor, it's a $15 copay. Every time you go, that's what you're going to have to pay. So there are differences between plans, and there's three main types of plans that are being offered in the market right now. There's copay, there's high deductible health plans, which is the HDHP. If I have to keep saying high deductible health plan, you might get really annoyed with me. So that's what that stands for. And hybrid. And hybrid kind of combines a little bit of copay and a little bit of the high deductible plan and mixes the benefits together. So I thought this slide might be helpful to kind of see the differences in plans, because right now you're offering a copay plan and you're offering 2 hybrid plans, and to kind of see what the differences are between those. So on a copay plan, it's kind of the richer benefit, right? The benefits are right there when you start on the plan in January. There's no deductible you have to meet first, and you have set copay amounts as you use the plan. For your primary care doctor or for the hospital or things like that, it's a set copay. Versus a high deductible health plan, when you start the year on the plan, you start with having to meet that deductible first. Then once it's met, the plan starts picking up those bills, and then you typically have a co-insurance. Versus the hybrid plan. I know I hate saying sometimes when it comes to health insurance, but it's sometimes, right? So for example, on our gold hybrid, you have a copay when you go to your primary doctor. There's no deductible that applies. But if you go to the hospital, the deductible applies first, then you have a co-insurance. So it depends on the benefit. So sometimes the deductible applies and sometimes it doesn't. And this is just kind of the key differences between the plans. So as we kind of talk about them, and we'll talk about this HRA funding by employer, because the more you fund or have to fund on a deductible, the more risk the town takes on, right? Because you're spending that money out to pay claims that you're not sure of if you'll have to fully fund all that amount, or if they're only going to use the plan a little bit and you only have to fund a little bit. So that's the risk, not the stability of like a copay plan where you know the plan's going to pay a bulk of that claim. We don't have to worry about funding an HRA, that type of thing. So one of the conversations is, what's the difference, like benefits loss of a copay or a high deductible health plan? So on the copay side of things, obviously there's less claim risk to the municipality. You don't have to worry about an HRA or administering one, which can come with its own headaches. Trust me, I help several of our municipalities through those headaches probably every week. There's no deductible, so benefits start right away for your employees. They don't have to worry about meeting a high deductible first. The premiums are higher on a copay plan. So you're paying more for the plan, but you're paying for more security for claim risk and better benefits for your employees. So it is seen as a richer benefit. Versus a high deductible health plan, which does incur a little bit more risk, because if you're funding the deductible, that's where the risk comes in. If you don't fund the deductible, it's not a risk to the town, but it comes back to the employee to pay that. HRAs are needed to kind of enrich a high deductible health plan to make it appear richer to employees, and to help. We have municipalities who are shifting that way, and they have to incentivize it to get people to move. And it is lower premiums, so it's lower cost to the town, lower cost share to the employees if they have to pay a portion of the health insurance. But typically employees see it as a diminished benefit, right? So they see it as, well, I have to pay a chunk of it, or I have to deal with this HRA to pay my claims first. And that's just the image of it. And there's typically more municipal administration needed. So maybe they swiped their card on something that's shouldn't have been covered, and now they need to pay that back. Maybe they swiped a card and they paid 3 copays at once, but that dollar amount doesn't match the claim amount. So then they need to provide further documentation to the HRA company or the administrator. Otherwise, they have to pay the money back. So a little bit more paperwork and a little bit more overhead in that sense. So comparing benefits to benefits, just looking at cost versus the amount of effort needed by the municipality to administer the plan. Copay plans definitely help enhance recruitment and retention. We in our area, a few years ago, we had several towns from Cortland County come to us because they're like, we need something that compete with that town. And we're like, oh, okay. It's because they were offering a high deductible health plan and the other town was offering platinum, and all their snowplow drivers were moving to the other town because they wanted the platinum plan. So just making sure you're competitive within your region of what you're offering to make sure to have that employee retention. And it definitely does simplify administration on your part. The high deductible health plans are becoming more and more popular. We hear lots of brokers pitching them as a way for towns to save money. And yes, premium is a lot lower on a high deductible health plan. And as long as there's good education to the employees about how a high deductible health plan works, they work well. If there's not good education, if there's not, a good foundation, typically the first year on a high deductible health plan is a little bit of a struggle for a municipality. There's a lot of learning curves. But it also helps control, long-term employer costs. And we hope it helps promote, subscribers realizing how much they're using their health insurance and are they using it as efficiently and effectively as they can. So currently you offer the Gold 5, the Silver 19, and the Platinum 2. So the Gold 5 and Silver 19 are hybrid plans. You have very little enrollment in the Silver 19, so I'm not going to dwell on that one too much. You do have your highest enrollment is in the Gold 5 plan. You do have a few in the Platinum 2, I think only one actually, but so we kind of focused in on those plans and how they compare to our plans. Was there a question? No. Okay, just checking. You're about this big on my screen, so I can't see your facial reaction, so I'm just checking. So our Gold hybrid is a little bit different than your Gold hybrid, and we'll go over those differences. Our Platinum plan is very similar to the Platinum 2, except our copays are lower. And then we were asked to present about the Bronze plan. We do have a Bronze high deductible health plan. We also have a Gold and a Silver, but we were asked to bring the Bronze forward since it is our lowest premium plan. So this is how our rates compare. And you're going to ask, why is the rate the same for subscriber and spouse and subscriber and children and family? It's because we are only a 2-tier plan, which means we only offer single or family. We don't offer the 4-tier you currently have. So anyone currently in subscriber and spouse or subscriber and children would move to a family plan with us. But our family rates are very competitive when you compare them to the family rates of your current plan, especially the Platinum 2. And they're still competitive when it comes to subscriber and spouse. They might be a little bit higher when it comes to subscriber and child. And I know I can go off on a tangent for about 25 minutes about how we're looking into 3-tier options, but I'm not gonna. But we are looking into implementing a 3-tier structure in a couple years, but we're still doing modeling and working with New York State, which I'm sure you're familiar with their response time. So we're working through that process, but it's not implemented yet. So this compares deductibles and maximum out-of-pockets. So right now on your Gold 5 plan, there is no in-network deductible, whereas our Gold hybrid does have a $1,200 individual, $2,400 family deductible. It does not apply to all services. It applies to the more expensive services like hospital, emergency room, ambulance. But to go see your primary care doctor or your specialist, it does not apply. It also does not apply to medications. And then the Platinum 2, the 2 copay plans do not have a deductible. You just go straight into your benefits for in-network. Now the Bronze plan, although it has the lowest premium, has the highest deductible, right? So it has a $7,000 individual, $14,000 family deductible. Which would have to be met before any coverage starts for medical or prescription. And I'm not going to read you all the numbers. I know we will be sending these to you later, but and you're not interrupting. If you have questions, feel free to just shout them out at me. So we talked about funding the deductible. So most municipalities within the consortium, not all, but most, fund with an HRA, which is a health reimbursement account. The reason they do it is because any unused funds in the HRA at the end of the year are still the employer's dollars. So they would roll back to the municipality. Typically, if you're going to continue to stay on the same plan and continue to fund it, they don't roll them back. They roll them forward to the next year to help fund that HRA funding. But it is a way for the employer to kind of mitigate costs. They take on the risk of funding a deductible to cover claims, but they also take on the reward of saving money if the HRA is not used or not used to its full amount. So we do, and we can send this out after, we do have group rates through Lifetime Benefit Solutions, who can administer HRAs. Not saying you have to go with them. We just try to negotiate down some pricing for our municipalities. So it's an option. But typically you forward fund the HRA only a certain percentage and then continue to reload the account with the administrator as you go out throughout the year and as claims hit the HRA fund. Each individual would normally get a card that they can swipe at the pharmacy or the doctor's office to pay for their claims. I always tell members, if they're on a high deductible health plan, do not pay unless it's been run through the health insurance. So pharmacies always have to run through your health insurance first before they even give you the medicine. But at a doctor's office, when you walk in and they say, oh, that's going to be $1,000 for that visit, don't pay that. That needs to go through health insurance first. Tell them to bill you, and then you can pay the bill with the HRA card because you only want to pay the allowable amount of bills. And this is all stuff, if you choose to go that route, I can come out and do this presentation to employees if you want, but just some heads up about how HRAs work. And HRAs are a device that was formed through the IRS, so they do have to be financially prudent and going by the guidelines, which means they have to be funds used for eligible expenses of an HRA. So you'll see quarterly audits done on claims that may come back to your employees who have to then submit documentation to back up why they used the card the way they did. So just some things to give you a heads up on. Benefit comparison, all of the plans cover preventative care in full. Primary care visits, Gold 5 is a $40 copay. Gold Hybrid, our Gold Hybrid is a $30 copay. Platinum to Platinum is the same. And just keep in mind you have that $7,000 deductible on bronze that has to be met before you have that 100% coverage. Specialist visits, Gold 5 is at 70, our Gold Hybrid's at 60. Platinum to Platinum, our Platinum plan is a lot cheaper to go to see a specialist. Mental health and substance abuse visits are covered in full under the Gold 5 and the Platinum 2. Under our plan, there is a copay for it, $30 with the Gold Hybrid and $15 with the Platinum. And urgent care is at a $70 copay with the Gold 5. On our Gold Hybrid, it's $60. And then the same copay for the Platinum 2 in our Platinum plan. Where the copays get pricier is where the claims get higher. So diagnostic and routine x-ray is not too pricey. But once you get into advanced imaging, ambulance, emergency room, and inpatient stays, it gets very pricey. So the Gold 5 has a $1,500 copay for an inpatient hospital stay. Our Gold Hybrid does apply a deductible, which individual is $1,200, and then it covers at 80%, leaving 20% till you reach your maximum out of pocket. And then the Platinum plans, the Platinum 2 is at a $500 copay, and our Platinum plan is at a $350 copay. Skilled nursing is just for acute care. It's not for long-term care placement. It's I fell, I broke my hip, I need a longer stay in inpatient rehab to get stronger to come home. It's not, I fell, I broke my hip, I'm never going home. So skilled nursing is a $1,500 copay through the Gold 5 plan. It has the deductible apply on the Gold Hybrid and then is covered at 80% under our plan. Platinum 2 is a $500 copay. The consortium's Platinum plan is a $350 copay. The other one is PT, OT, and speech. Most people use this benefit, but they don't normally use it up to 60 visits a year. On average, it's about 10 visits a year. But the Gold 5 plan has that at a $40 copay, and the Gold Hybrid is at a $60 copay. The Platinum 2 versus our Platinum 2 is a little bit less at the $15 copay. We just try to keep our specialist visits a standard copay. Radiation therapy, chemotherapy is all covered by your current plan and under any of the consortium plans, where the copays are a little bit higher on the Gold 5 plan and on the Platinum 2 plan as they compare to the Gold Hybrid and Platinum with us. And one thing I probably should have mentioned earlier, we are looking to consolidate you down to one plan because of your size. So just keep that in mind as you're looking at these plans, which plan might be the best fit for your employees and for the coverage and the price that you're looking to offer.
Why, sorry to interrupt, but why does our size
Yep.
warrant? Yeah.
So it has to do with adverse selection. So when you allow your employees to pick from several different plans, the trend will be the sick will go with the expensive plan and the healthy will go. No, the health, yes, and the healthy will go with the expensive plan and the sick will go, I'm saying this wrong, will go with the expensive plan. So anyway, the sick people will go on Platinum and the unhealthy will want that extra coverage, so they're not paying so much out of pocket. They'd rather pay more for their health insurance than pay more for their claims. Whereas the healthy ones, the ones who never use their health insurance, they don't care what their deductible is, will go to the cheaper plan. And what happens is then they're not supporting each other inside of the plan, where you have healthy and unhealthy together, they're all paying the same premium and it balances out. When you have some paying less and some paying more, and some accruing more claims, it doesn't balance out. And that's across the consortium. So the idea of being self-funded is the premiums that come into us are paid right back out to pay the claims. So if we're not keeping a balance across the consortium that way, we become unbalanced and we're no longer collecting enough revenue to support all the claims from our members. And I know Ellen's unmuted, so she's itching to say something.
Yeah, so the reason we are different than Excelis allows you to select as many plans as you want when you're on a community rated plan like you are on. It's safety in numbers, the balancing act that Kylie talked about. They have many more members than we do, and across the board, it balances out where there's some healthy people in lower premiums, and there's, you know, so the balance in the overall organization, because we are smaller, we have to control that adverse selection. We don't have as much flexibility as Excelis, and that's why when we have new members come in, when current members are making changes, we have guardrails in place based on your size, how many choices you get. So we try to force our large employers into 2 plans and our small employers into 1 plan to help control that risk pool, which is our self-funding mechanism.
I'm sorry, I thought that one of the points of the consortium was the risk was balanced or like spread across to all the members of the consortium. Maybe I don't understand.
It is, but we're much smaller than Excelis, so we still have to put guardrails on how we are managing that risk. So across the board, we have those rules, to help manage that risk for the entire consortium.
Okay,
Kylie,
thank you.
Yeah.
do you have any scenarios of, say, a typical two-person family? You know, what that looks like throughout the course of a year as to, you know, what services they would need? And you know, how each of these plans might affect those individual groups, or you know, four-person family scenario for a two-person family, and then single.
We have some examples of like what a pregnancy would look like, or what a knee replacement would look like, or someone on diabetes. But when it comes to a family, it really does depend on their health. And as we've seen in the last few years, it also depends on what medications they're taking. There's some really expensive medications out in the market where they can be perfectly healthy, and that's their maintenance medication, but the maintenance medication is $2,000 a month. Which plays out very differently if you have a deductible that's hitting before the medication copays versus after. You know, so if you're on a $2,000 medication and you're on the bronze plan, you're going to be paying $2,000 at the pharmacy with your HRA card, hopefully, if you fund it that way, you know, for several months before you reach your deductible, and then the plan kicks in and starts paying. Versus like a platinum plan, if you're on a $2,000 medication, you're going to pay your tier 3 $70 copay, and that's it for the rest of the year each month. So I can definitely create some scenarios for you, but it really does depend on usage. And that's why Elin was saying about having members call me. I don't mind doing one-on-one conversations where we go through their drug lists, or we go through what they've, you know, had happen in the last year. Maybe they had a hip replacement, and we talk about how that cost might have been different if they had been on one of our plans versus the plan they're on now.
Thank you.
Yeah.
Is there any flexibility for Mendon to have two plans for the employees?
We do have a plan management policy, and we could definitely share that with you. It would be for a group your size, it would be specific to a union contract. So if your DPW were in a specific agreement that said everyone in DPW has to be in the consortium gold hybrid, and then everybody else is in the platinum plan, that would definitely be a waiver we would consider. But on the whole, we would ask that you follow the plan management policy.
Okay. Thank you.
And I do want to go back to the risk question, because we were kind of answering one question with the answer to another question. The risk to a small group in the consortium is safety in numbers. You're a small municipality. You are able to share in a self-funded environment in a bigger population. So as you could not become self-funded because you would take on way too much risk as the municipality. So the safety is becoming a member in the consortium. So it's a little bit different than how we balance adverse selection within the consortium. So the individual question is managing risk in a larger pool, such as the consortium helps control your risk, whereas the answer about adverse selection, choosing one plan, is we're not as big as Excelis, so smaller pool, we need to make sure we're managing your risk. So it was kind of two different questions, and I wanted to clarify that before Kylie went on with benefits.
Thank you.
We do offer ancillary benefits like durable medical equipment. Right now, all of your members are seeing a 50% coverage for durable medical equipment. We cover that at 80 or up to 100 with the bronze plan after deductible. Durable medical equipment is not just wheelchairs and hospital beds. It's also CPAP machines, CPAP supplies, oxygen, all those things that are important to have access to keep someone healthy. We also cover chiropractic care and acupuncture. As long as, these are the copays for in-network providers. But as you can see, we try to make sure that the copays are equal to or a little bit less than the current Excellus plans you have. The only difference is the acupuncture right now is a $15 copay with Platinum 2 and a $25 with our Platinum plan.
Just to clarify, Kylie, I think you recommended that our Medicare recipients stay in the current plan that we have. Is that correct?
Yes, because the current retiree Medicare option you have is a lower cost than our Medicare supplement plans at this time.
Okay, I wanted to clarify that for people. Thank you.
Yep. And then our benefits do include vision and hearing as well. The Gold 5, Silver 19, and Platinum 2 didn't have information about routine hearing exams. I am assuming they're covered, but I don't know what the copay rates are or co-insurance rates are. Our Gold Hybrid and our Platinum plan do cover pediatric eye allowances at a little bit higher of a rate. Whereas the Gold 5 and Platinum 2 do cover the routine vision exams for pediatric and adult in full, where our plans do have a copay for that benefit. But the benefits are there, as well as for hearing aids. Pharmacy coverage, your Silver 19 requires that the deductible be met first, and then the copay rates will kick in. Our Bronze plan, you have to meet the deductible first, and then everything's covered at 100%. Your Gold 5 plan has a $15 copay for Tier 1. Tier 1 is standard, normally generics. Tier 2 is normally preferred brand, and Tier 3 is normally non-preferred brand. Generally, there's always sometimes this goes here and there, but generally that's what the different tiers mean. Your Gold 5 at a Tier 2 is 40% of the cost of the drug, and Tier 3 is at 50% of the cost of the drug. Our Gold Hybrid in comparison has set copays for all of the tiers. So there is no percentage cost to the drug. It's just a set copay for those medications. Your current plans do offer an Excellus preventative drug list, not subject to deductible. Our plans do not. So sometimes there's preventative medications that an employee could be taking and they're getting a lower copay. And that's a set list that Excellus creates and has available on their plans to make preventative medication a little bit more accessible. Of course, if any of your members want to check their drug list, I'm more than willing to do that with them to see if that would shift at all with changing to our plans. The other big thing is our plans offer what's called an open formulary. So every insurance plan you have has what's called a drug formulary. It's a list of medications they will cover, and anything not on it is what they won't cover. And ours doesn't really have we won't cover unless it's an over-the-counter medication, which means any medication can be in our formulary. It may be a Tier 3 medication. It may be brand new. The only time it wouldn't be covered is for experimental uses. Whereas the plans you're on now have what's called a closed formulary, which means they have to cover a medication in every bracket, meaning they have to cover at least one insulin. They have to cover at least one inhaler in this bracket, but it doesn't mean they cover them all. So sometimes that can be restrictive to members who are trying a medication's not working and they want to try something else. So just to give you an idea of the cost. And then we do have some ancillary benefits as well. So by anyone who is a member of the consortium, being a dependent, a spouse, or the subscriber themselves, has access to CannaRx. CannaRx is not part of the health insurance. It's a voluntary prescription drug program. They only deal in name brand medications. If your name brand medication is on their formulary, you could enroll with them to become a member, and they would ship you a 90-day supply of the medication for zero copay. Not all drugs are on their formulary. They don't ship anything that's temperature controlled. but they have a wide variety of inhalers as well as drugs like Eliquis, Premarin, Janument, Jardiance, Advair. The list goes on and on. They have quite a long list. This is just a small sample of the most popular ones we see our members using through them. But it is an opportunity for our members to save money on the cost of the medication and for the consortium to save money on the cost of the medication, which helps reduce down our claims, which helps stabilize our premiums. So it's a useful tool all the way around and a win-win for the consortium and for its members. We also handle all COBRA administration for all of our small groups. Town of Mendham would be no different. They would be considered one of our small group municipalities if you are to join, which means when you enroll a new hire into health insurance, we will make sure a COBRA notice is sent out to them, to their home, to make them aware of their COBRA rights, which is, that they'd be eligible for COBRA if they ever turned the coverage. When you turn them off of coverage, they're also automatically sent an election letter where they can choose to enroll in COBRA or not. If they choose to enroll, we handle the enrollment, and we also handle the billing. And then any funds collected, because we contract with Lifetime Benefit Solutions to do the administration, any funds collected are sent back to the town to offset the billing for COBRA from the consortium. So we try to make it as efficient as possible because there are certain very strict deadlines to send out COBRA notices for termination for new hires. And this helps ensure that all of our small groups are meeting those requirements because most of our small groups, our benefit clerks at our small groups are not just doing health insurance. They're doing 100 other things. So this is one thing to take off their plate.
Kylie,
Yeah.
may I ask how much longer your presentation is? Not that it's not informative, but we have a lot on.
But we
our-
were late and we're keeping you late. You're right. Want me to skip ahead, Elin, to the...
Let's skip ahead. Because these are all ancillary and we can discuss them at another point.
Yep.
So you have already complied with our application process. I just want to let you know what kind of happens from here, and the dialogue can continue, tomorrow, next week, until the September board meeting. So the finance committee will start looking at new member applications tomorrow. What we don't get through tomorrow will go to them the beginning of September. So we will let you know when the finance committee has made a recommendation, and that recommendation will go to the board. All our new members have to go through a new process with the Department of Financial Services. So it's a new process. We'll have to figure out what that looks like, and we'll communicate that to you as we go through it. It's more than an organization, not you, the individual. So that'll just mess up our timeline a little bit, but you should know by the end of September 24th, that you're eligible to be a new member. And then we will ask you to sign the municipal cooperative agreement at that time. We'll request a bunch of information from you. The good news is, as far as transferring employees from your plan to the consortium plan, we can do that all electronically. You don't have to fill out new paperwork. You don't have to do the data entry yourself. We can scoop it up from Excelis and drop it into the consortium. So what we will need to know soon as part of the approval process is what plans you are considering, and make a decision on plans, because that does affect our budget in the long run, premium income and claims cost out. So I'll continue the conversation with Joe as we go through that, which direction you want to go and advance your application with such. I think the other slide we have is the one we've already offered up of Kylie as you go through this decision-making process, to get in touch with Kylie. And I think our next slide is just showing you our lean machine is, this is it. This is the consortium. You're seeing 2/5 of the staff right now. And that's why we have been successful with our rate stability, is 96 cents of every dollar of claims goes specifically to paying your claims. And the other 4% is required stop loss insurance. The less than 2% is staff wages and other taxes and required administration is in that 4%, including the consultants and the attorneys and things like that that we need. So we will wrap it up there, see if you have any questions, and know that the conversation isn't finished, that we will continue it going forward. And we thank you not only for your time this evening in setting it up, but also for placing your application with the consortium.
Elin, I think this has given us a good picture of what we need to do going forward in order to, make the comparisons and such that we need. And I will definitely be in touch and sharing everything I learned from you and Kylie with our board. And I appreciate the opportunity and the information.
Great. Thank you so much.
Thank you.
Thank
Appreciate
you.
the time.
Thank you.
Right. Onward to the town supervisor's monthly financial report. The motion,
I will make a motion to acknowledge receipt of the town supervisor's monthly report for June.
we have a second?
I'll second.
Any discussion? All in favor, say aye.
Aye.
Any opposed? So moved.
Welcome. Thank you.
Town clerk's monthly report.
Who seconded the
I did.
Town clerk's monthly report.
I'll move to acknowledge receipt of the town clerk's monthly report for July 2026, showing receipts and disbursements in the amount of $54,577.78.
I'll second.
Okay. All in favor, say aye.
Aye.
Opposed? So moved. Approval of minutes.
I'll move to approve the minutes of the regular meeting held July 13th, 2026, and the minutes of the special meeting held July 27th, 2026, as presented.
Second.
Okay, any discussions? All in favor, say aye.
Aye.
Any opposed? So moved. Budget adjustments, we have two here, actually. There's one listed, and I'll make an amendment to accept the second one. HFL Community Programs, motion, I'll make a motion to move that $47 from account B7550.4 to move to B7320.4 to cover the added cost of summer recreation. I'll add that when we budget for that, it's usually an estimate and sometimes needs readjustment. In this case, we need to increase it by $47.
I'll second.
Any discussion?
I am going to recruit myself because part of my salary at school is from this. So that's my daytime job and I am not going to vote.
We
And I-
appreciate that.
I caught this $47 too on the, going through the voucher, so, yeah, I'm aware.
Okay, all in favor? Say
Aye.
aye. Any opposed? So moved. The second budget adjustment is for legal fees. I'll make a motion to add the second budget adjustment for attorney fees to the agenda. May I have a second?
I'll second.
Any discussion on this? And all in favor, say aye.
Aye.
Any opposed? So moved.
This was just the,
I was going to ask a
This is
question.
just
We have
to
two.
add the item
to the
to the
agenda.
agenda.
Okay, all right.
So now we have the actual budget adjustments.
Okay.
Okay, that amount seems. Make a motion to move 13,660. Oh, no, that's wrong. I'm sorry. How did that happen? You happen to have the correct number there, 16.
Just say 16. It was like 16. Oh, I wrote on 16.
Thank you. Sorry about that.
$1,603.41.
But we didn't need a, oh, we are over budget?
By that much
Okay.
for this month. because
Well, are we over the
We're-
threshold? Cause
We're over the monthly threshold.
we don't need to do a budget adjustment for that, though. We just need to are we out of money?
The motion is to transfer the,
Right.
I'm sorry.
It's not to transfer, it's just to pay more than the.
But we
Yeah,
have agreed on
because
in
we
January.
Decided we would have a cap. So the motion is to pay more than the 4,000 cap for this past month.
Yeah, it's not a budget adjustment. It's just
Right.
a,
Sorry, I was reading it. I did a little cutting and pasting and I was off. I apologize. So the motion is to approve a budget adjustment of over, of $1,603.41 over the $4,000 monthly limit that we agreed on, in January.
So I will second to increase the town legal fee cap by $1,603.41.
Okay, any discussion? Okay, all in favor, say aye.
All right,
Aye.
Any opposed? So moved. Okay,
all right. I will move to approve all claims on vouchers numbered 20.
this one.
We just did that one.
What's
community.
this one?
First one is you had to move money. The second one is
Is
to
we have to
pay.
pay, yeah, we have to
Oh,
do,
we didn't do the one.
Yeah.
Oh, sorry. So I'll move to approve an additional $47 to be paid from account B 7320.4 to cover the added cost of summer recreation.
we already did that.
We moved the money. Now we
Oh,
need to
I'm
pay.
sorry, thank you.
a second.
I'm going to
Any
abstain
discussion?
again.
Any discussion?
I'm just gonna
You're
abstain.
recusing.
Yes.
Okay. All in favor, say aye.
Aye.
Any opposed? So moved.
Thanks, Rebecca.
Yeah, sure.
I'll move to approve all claims on vouchers numbered 26-390 to 26-399 on general abstract 26-08A in the amount of $33,959.43.
Second.
All in favor, say aye.
Discussion.
Aye.
Any opposed? So moved.
I will move to approve all claims on vouchers numbered 26-400 to 26-438 on general abstract 26-8B in the amount of $129,128.65.
Second,
A second.
any discussion?
I'm gonna recuse myself because that check is in there.
All in favor, say aye. Any
Aye.
opposed? So moved.
I move to approve all claims on vouchers numbered 26-188 to 26-215 on highway abstract 26-8 in the amount of $144,710.62.
A second.
Any discussion? All in favor, say aye.
Aye.
Any opposed? So moved.
I want to notify the board that we reviewed library vouchers 26-98 to 26-105 on library abstract 2026-808A in the amount of $1,790.02 and was presented to the town board for payment. Would also like to notify the board, library vouchers numbered 26-106 to 26-110 on library abstract 2026-08B in the amount of $9,100.88 was reviewed and presented to the town board for payment.
Okay, thank you, Tanner. Declaration and disposition of surplus highway equipment resolution. Make a motion to declare the following surplus and authorize its disposition at RTI Auctions, Roy Teetsworth Incorporated. a 2010 Volvo 10-wheel dump truck, model VHD 64 B200, vehicle number 94. A 2012 Kenworth 10-wheel dump truck, model T80, vehicle number 97. A Ferris zero-turn mower, model IS 2100 ZKA V2661, equipment number 44. Do I have a second?
I'll second.
Okay, any discussion?
I'll just ask, these are all in the disposition?
Yes.
Just they're all, okay, nothing out of the ordinary,
Yes.
okay.
All in favor, say aye.
I,
Any opposed? So moved. Okay, here we get to the meat part. I would like to, before proposing this resolution, I would like to turn the meeting over to council.
Thank you, Mr. Supervisor. Hello, everyone. So for a while now, discussions have been occurring between the village and Pike Construction and FF Thompson about the location of an urgent care center where the former Critics Restaurant used to be. As some of you may know, the village ZBA last week on the 3rd approved site plan and with a couple different conditions and a couple variances. Now, the property is supposed to be transferred, the village owns it right now, it's supposed to be transferred to Pike, and then Pike is going to lease it to FF Thompson for a certain amount of time. There were a couple things that came up during the discussion, some at the public comment sessions that have been really quite nicely rolled into kind of how this is supposed to work between the work of the town and the village and Pike and FF Thompson. But there are still a couple outstanding matters. One of them has to do with this green space. So it was very important to the town and the library that the library's view not be blocked from the street. So there's going to be some green space that's set aside, and we have to figure out how we want to deal with that. But at first it was suggested that maybe the town take title to it, that would just be deeded to the town. And that way the town can make sure that it's always green space. The library can always be seen from the street. But there are some environmental concerns with it, and that is a concern for the town because anyone who takes title to property where there is environmental contamination could potentially be liable for the remediation, investigation, and cleanup of that. So we've been trying very hard on behalf of the town to nail down exactly what this environmental contamination consists of. And we haven't been able to do that. Late today.
If it exists.
Well, about 4 o'clock today, the real estate broker sent me an email saying that there was an additional report that he had sent along. I apologize, I was on a plane. I haven't been able to and kind of just trying to compose myself after dropping my son off at college. My apologies. So I haven't been able to go through that. He believes that there is a reference in that it's some report of some sort. It's not an official phase 1 or a phase 2, but there is reference to a phase 1 in it. So the real estate broker is going to try to track that down for us. In addition, we haven't received all the, no, I'm sorry, it was about 4:30 today, I think, from my email that we received the title documents. Certainly we want to make sure that there's nothing in the chain of title that causes concern if in fact the town is going to be taking title to this green space. So we'll go through that. Part of the problem there is that it covers more than just the lots that are at issue here. So we're going to have to go back to the title company. This is my colleague Carrie Ann very kindly looked at this evening and gave me an initial report that said that it's bigger than just the green space for certain. So we're going to have to go back to the title company and ask them to narrow it so that we're looking at just what we're interested in. So you know, I am not in a position to recommend to the board that you have everything you need to consider this evening. That being said, I have heard through the grapevine that Pike might be amenable to actually keeping title to it, but putting some sort of negative covenant or conservation easement on it that would forever bar any development of what we have defined the green space. And that is kind of an elegant solution to this if Pike is in fact willing to do it. I have not had conversations, Carrie Ann has not had conversations. This is just through the grapevine that I've heard this. I think that we can absolutely discuss this today. I know the board has a lot of questions and a lot of concerns about things, and I will do my best to answer them. Those I can't answer, I will absolutely get you answers to. And I can get this from Pike or Thompson or someone. And so I think that, you know, certainly there's a couple different, there's the green space, but then there's also the easement. So it's complicated. But to make this work for everyone, to have appropriate access to the urgent care center, they want to reconfigure the driveway somewhat, and that is going to implicate, you know, certainly the town's property rights because they've got the neighboring property right there. There's parking issues in part because of this green space, so kind of like a swap for the green space for parking that is also contemplated. Snow removal, the town has agreed to allow snow piles to be accumulated on town property so that the urgent care parking areas can be maintained in an appropriate manner. And then there's some work that needs to be done for stormwater management and utilities. So that's going to be more of an access easement. It's not going to be like it'll be permanent in the sense, you know, for maintaining those facilities, but not like they're taking it like they are with the parking. So I think tonight we can discuss the easement. We can put a condition on it that there be some sort of negative declaration or covenant and or conservation easement, something to preserve that land while Pike still holds title to it. And then I would actually suggest that we not consider what was on the agenda as number 16, which was to accept title to the green space. I don't think that we're in a position to do that at all tonight, even with conditions.
Because we don't know what the lines are.
Yeah, I mean, I think that between the engineer and me and Carrie Ann, we can figure out what the boundaries of the green space are, and that's something that we can do after the fact to everyone's satisfaction. That would certainly be a condition that I would put on it. But at the same time, we don't know that we're going to take it, and at this point, without knowing the title and the environmental condition of the property, I can't in good conscience recommend that you agree to accept it. So.
Well, then does that have flow down effects to the next resolution, which I think is the easement itself, and granting the easement? Because if we don't know what's disposition of that green space, then
So
what's to,
that's a great question.
yeah,
And if Pike keeps title to the green space and does this negative covenant or conservation easement, something like that, we haven't quite worked out the contours of that yet. We know we want it to be permanent. So if Pike is willing to do that, then you can go ahead with these because Pike will keep title to it. It doesn't matter what it makes no difference to the town what the environmental condition is because there won't be any liability to the town because you're not taking title to it. And also, if there's a problem in the title report, then again, it's not the town's problem because you're not taking title to it. So Pike's going to keep it and keep all the concerns that we have. If we were to take it, then and put that conservation easement or negative covenant on it, then you can go ahead with the easement tonight.
but we don't have that confirmation from
Right.
them.
We don't.
Right,
Yeah, we don't, like,
We don't.
I'm watching body language and lips back here and I'm seeing, I don't know about that, from the Pike guy. So, sorry, I don't remember your
No,
first
she's
name.
the architect.
Mike's not here.
Mike's not.
Oh, I'm sorry, I apologize. But yeah,
Conservation easement sounds like the
yeah, that sounds like a great solution if they're willing to do
And
that, but we don't know that they are.
We don't
We
know
don't
for a
know that
fact,
they are.
right?
And
Yeah.
I will tell you, we are getting an incredible amount of pressure from Pike, despite the fact that we have told them for weeks that we don't have the documents to have you do something tonight.
Wouldn't that be a decision for the long-term water property bill as well?
I'm sorry.
The conservation easement discussion would be
I believe once it's set, it's irrevocable.
with the long-term.
Right, I mean, honestly,
Yeah.
that's for Pike, not me.
Yeah, I'm at the Thompson, it's the first I'm hearing this portion of
Okay.
it, and so we have to work that out.
Yeah.
As you can imagine, our attorneys would want to make sure that there's no liability.
I'm certain.
If we're allowing people to use use it, for whatever purpose it issues.
So
there's so many things to work through to get that.
Agreed. This is the best solution that I could recommend to my client. Given the pressure that we're getting to do this and the fact that we've been asking for weeks and finally got documents at 4 o'clock today. So.
That may or may not be helpful.
Exactly.
Yeah.
So the town is absolutely trying to work with you. I have heard, I did listen to the ZBA presentation last week, that there's a lot in the community who think that this is a good thing. We need to make sure that the town isn't exposed, because of what we don't know. So that was the best I could come up with. It is entirely up to the board, whether you want to go ahead and consider this, or if you want to just wait until the lawyers get the documents and we can talk about this, and then we can socialize all the ideas with all the parties.
I said this in writing to some people, but I'll just say it here. While I recognize the community's strong support for the urgent care and agree that it will be a benefit to Mendon, our obligation is to safeguard the town from incurring avoidable costs and are accepting long-term liabilities created by this project. So we need to make sure that our interests, financial, legal, and safety related, are protected.
And if I could just say on the record, I don't know if now's the time or not.
Go for it.
Some of the concerns that I noticed, I'm an environmental professional. I have a PhD in geology and environmental geochemistry. And so this is like my wheelhouse. The environmental report that was provided indicates that there were some sampling issues and that the representativeness of the samples, especially as it relates to volatile organic compounds, VOCs, which are petroleum products, are unreliable. And given that property was formerly used as a garage, an auto body garage, and had gas pumps on it, the sampling wasn't done properly. There was also, they did composites instead of grab samples. I don't have any confidence in the results, and the report itself even says from the analytical company that the VOC analyses are likely biased low because there was no seal on the VOC samples. So without that assurance that, if there wasn't a former gas station on that property, and we don't know where tanks might be buried, this wouldn't be an issue probably, but given the history. There's also no phase 1 report provided, which gives you the justification and rationale behind your sampling and analysis plan, like why you choose sampling locations and what you sample for, without any historical imagery, historical documentation, history, ownership, none of that. Nothing about the hydrology that might exist. The topography might flow away from the green space, but there's a low wetland area on the other side of that green space. So if there are contaminants down there, it could potentially flow underneath that green space toward that low spot. So I just have a lot of concerns with what was provided as far as the environmental report. And just think that we need to do a bit more due diligence before we accept ownership. As grateful as we all are for the negotiation and willingness from Pike to find a solution, like Kim said, we have to protect the town's interests as well.
So do you see any way, giving all these outlying conditions, that there was any way we could have a resolution to pass this tonight with conditions? It sounds to me like it's way too complicated to do that, but I'm just a layperson. I don't really know.
If I can interject for just a second. So we have 2 meetings in September. I think it would be great for the board to know if the current and future owners of the property would entertain a conservation or environmental easement with rights of access for the library in the town. The town and the library have insurance, maybe that we could provide them that, to help ease any liability or injury type concerns that they have. Given some of the concerns of the board, I think that would be really good to know what their reaction, what their thoughts on that would be. and then we can follow up in a couple of weeks. I mean,
That seems like a very logical plan to
Yeah.
me, but if the board wanted to try to fashion something tonight, I'd be game to help you guys do it. Just want you to know that, but I think also, you know, taking some time and being certain that we've got the information that we need, we've had the time to actually digest it. And we've had the conversations that we need to with the stakeholders so that everyone's on the same page. That's really the best way to go.
I'll read it, I agree. I think it sounds too complex, and there's too many things could be missed by trying to push it tonight. And, I have heard positives from others that they'd be willing to do the conservation easement, but that isn't the whole thing here. There's a lot more to it. We haven't heard from Pike really on that issue at all and how they're involved with this. I think we need to. So.
I also had another concern that I just want to raise, and I think that there are some interventions that that can come up with. These guys don't want to listen though. It's related to the sidewalks. I know that there was some concerns from the community about families or whoever having to cross that driveway on the sidewalk, and you guys came up with an elegant solution to kind of go around and connect. However, I think the only access to that, I call it safe passage, requires using stairs. And so I worry that only people that are able to use stairs can access that. And I didn't know if there was any work that you had done to look at some, you know, like maybe like a little cutbacks kind of sidewalk ramp up there, so people that didn't want to cross that didn't have to. Oh, I see you moving. There's movement. Do you have some ideas?
Tom's gonna answer this. I'm gonna answer that question.
Okay, awesome.
I think to do that, they would probably lose 2 parking spaces. So, right now, if you're standing at the decision point of either going up the side, up the staircase to their urgent care facility. If you're at this decision point, here's the proposed building. And you can't use the staircase.
Can you actually come up and?
Yeah, that's a good idea. My worry is that we're sending a message that says you can have safe passage if you're able-bodied, you know?
Understood.
Yeah.
So right now, there's about 90 feet, we'll call it. Right here is if you're in a wheelchair, you'd have to come up the sidewalk, come back around and come around here. It's about 410 feet. By the time you transition these steps, it's about 4.8 feet. You need about 80 feet. So that puts you at around 170 feet of linear distance from here versus the 410. You need a number of switchbacks. You need a landing here, space. You need to come up 2.5 feet. Then you need another landing. You got to come back over another 30 feet of ramp, with then another landing up at the top here. So when that's all said and done, either they're losing portions of the front, the retaining wall would be pushed out further. It would create more visibility issues along North Main Street, and they would potentially be losing an additional 2 spots. So for those reasons, I can see why they suggested doing this, and it does make sense. Yes, it is a longer path. And then we did talk about some slope issues over here too.
Yeah, thank you for that. And I wasn't even thinking about that group of people. I was thinking more about like kids on bikes that are trying to get to the library, or, you know, mothers with strollers.
So currently they do that right now with the existing.
They do, but you don't have people who might be taking turns quick because they have a broken bone or a kidney stone or something. And
You're talking about.
yeah.
That's the risk zone she's
So
talking.
this is
Yeah.
the risk zone that you're talking about?
Yeah.
So from a visible standpoint, you have the black pavement on both sides, you have a concrete area. And that they have added detectable warnings, which is typically not required for this type of crossing, but that is a safety feature that they have added.
I'll
I
add that, and I'm not speaking for Beth Thompson or anybody in that team, but we did have some conversation about willingness to add other safety devices that I think would make that pretty fairly safe. Stop signs, speed bumps, things like that, that would just really, there's no way someone could be flying through there.
Yeah,
There
just
could be
speed
some
bump
stops.
would be great,
some
yeah.
Bumps here, there could be a stop sign, you know, you could have 2 stop signs in the future if it became. an
Yeah,
issue.
that would, I think, help. I hear what you're saying, that's a lot to ask after all the other concessions, that have been made, and I don't mean to. I don't.
Thank you.
Yeah, thank you.
I'll say it's something that can get evaluated over time, right? So I mean, if it's something where it is something that presents itself as a concern, it's fairly easy to add some speed bumps or something along those things. So it's not necessarily something I would just say may need to be put in place day one, but you know, as it becomes huge and it becomes an issue, I think it's something where there's relatively easy mitigation measures like Joe just mentioned, we've talked about.
Okay. Or we could put speed bumps in on day one, so we make sure that nothing bad happens. You know, we could talk about that.
Okay, so I think it sounds to me like a resolution to table 15 and 16 is in order. So,
So moved.
okay. Good.
Do we have to vote
Do I have
on
a
it?
second?
We got a
Second.
Okay, any discussion we've had? All in favor, say aye.
Okay.
Any opposed? So moved.
So 17.
So 17, we are on to 17. Rather,
Supervisor, would you like to speak to this if you'd like?
yes, please do.
Okay, so, there's been talk about this retaining wall project at 13 Victor Message Road. We have the contracts in place to get the work done, great cost savings were found for that. This access agreement is just for, allowing us and our contractors to get on the property to do the work and to make sure that there's limitations of liability and such, for that, so.
So with that said, I'll,
Megan,
Yes.
has this been run by the property owner? Has he agreed to this?
yes.
Yes.
Well,
I did
I'm not
not
Megan,
admit that,
but she wasn't here, I was.
Okay,
He came in and we signed it all today.
okay, good,
Okay.
good.
So it's already been signed.
Yeah.
Okay.
So do we need a resolution?
Yes, we sure do, to ratify the contract, the access agreement.
Okay, so
did Sue sign it as well? They both signed it?
they did.
Okay.
You want me to speak to it? You want me to put the language together?
Well, I see it right here at the end,
Okay.
the motion, the foregoing resolution was put to a vote and duly adopted.
So this would be a resolution to
Yeah.
ratify the access agreement that appears in the packet tonight. And this is actually a type 2 action under seeker as well. So that no additional environmental review needs to be done here. This will be recorded in the Monroe County Clerk's office, so that it's forever known that the town is no longer responsible for this retaining wall after this this repair.
Great, thank you.
Great.
Very
So
good.
if someone wanted to
Perfect.
make that motion.
Joe made it. We should
Okay.
use it.
Yeah, we need
I'll
a
second.
second.
Okay.
Okay. Any further discussion? All in favor, say aye.
All right.
Hi.
Any opposed? So moved.
Nice work. Getting that.
Thanks.
Whoever did the work on that, nice work.
A lot of people.
Yeah.
So I'll move to authorize the highway department to purchase 2 Polar Flex plow blade systems to be paid from account DA 5130.4 for an amount not to exceed $15,000.
I'll second.
Okay, any discussion?
Just a highlight on that, those blades, just for one set, has gone up $1,600 in 4 months.
I believe it.
Okay, all in favor, say aye.
Aye.
Aye. Any opposed?
Did you have a discussion?
Oh,
Oh, no, it's fine.
okay.
Oh,
No, seeing no opposed, so moved. Number 19, Highway Department.
I'll move to authorize the purchase of a 3046R compact utility tractor with attachments from Land Pro Equipment, with an amount not to exceed $87,048.28 to be paid from account DA 5130.2.
Do we have a second?
I'll second.
Okay, any discussion?
I just wanted to point out, that's for the new sidewalk plow tractor. The existing one's 24 years old.
Is that it?
Thank you for pointing that out. I'll also add that, it seems like Highway's buying a lot of equipment. Well, they are, and it's not on a whim. This is a long-term plan of replacement. It's a responsible way of doing that, keep our highway department efficient for the public. So I just want to say that, yes, this is all planned. It is a lot of money, but it takes a lot of money to run a highway department, so, and keep our roads safe.
The original plan, if we had just replaced the sidewalk wall, would have been $55,000, but this piece of equipment gives us a ton more options. Everything else, way more versatile, more year-round usage,
Okay,
and stuff like that.
thanks for your due diligence and research on that and plan.
And there's no issue with that, however many, 35,000-ish over as far as the budget goes.
We have plenty of
Plenty.
money. Not gonna buy any speed limit signs or anything like that this year. So
Oh,
there's plenty of money in our equipment.
you got the county money coming in, right? Yeah.
We'll work for the county to.
Yeah. Yeah.
They're back
Okay.
for us.
Ah,
All right, I moved
Exactly.
to up,
did we
We
didn't vote on that yet.
So all in favor?
Aye.
Any opposed? So moved. Highway Department Super Cab.
I'll move to update resolution 26-144 for the 2026 F550 Super Cab 4-wheel drive truck to be purchased for the purchase to be paid from account DA 5130.2 rather than DB 5110.2.
Second.
Okay, do I have a second?
Yep, I seconded that.
Okay, any discussion on this?
Who seconded that?
I did.
Rebecca? Seeing no discussion, all in favor, say aye.
Aye.
Any opposed?
Aye.
So moved. 21,
I'll make a motion to approve an additional $20,000 from account B8021.4 for the Mile Square sidewalk for added design, planning, and driveway culvert work due to having to move the sidewalk placement closer to the road.
I'll second.
discussion,
Huh? So this is just a little bit more work. This is MRB?
Yeah.
Okay.
Tom, would you like to explain? Cause I can if you don't,
Yeah, we've gone back and forth with multiple times. There was one neighbor who expressed some interest and concern. Originally he signed the easement and agreement of it. And additional information was needed.
Planning contraction.
Amended his decision. Changed it so we needed sidewalk closer to the road. Integrate more use of walk road.
What was taken out was this one.
That's kind of where we got.
I heard.
Correct.
Yeah.
So, yes.
Do
okay,
we need to,
if
if
we
we're,
have a second, yes, we did.
It's getting
Any other-
close.
Any further discussion on this point?
yeah, if we're gonna do that, we need to add money to that account.
I don't, we just,
We're taking,
it's the sidewalk account.
we're taking 12,453 out of it. So, I believe we only have $28,000 left total.
We,
20.4.
Where did you get that number?
What number?
This one.
From the vouchers.
We had this discussion.
They moved
Maybe.
6,000.
Yes, but that was to cover other
That
things.
was 8023.4.
So it's not on this particular,
Oh, okay.
That is planning projects contractual, not sidewalk planning, sidewalk planning.
21's again.
21.4, that's what Tanner is.
8020.4.
8021.4.
8020.4.
There's a 20.4, which is their contractual services, or
Oh, wait, sorry,
21 is sidewalks.
sorry. I was looking at, I thought that said 8020. We're okay on 8021. Sorry.
That's what I thought, but hey,
Sorry.
you know, it might have made a mistake, so I appreciate you bringing it up.
Sorry,
Nice almost.
never mind.
Okay. Okay, with that discussion, any further discussion? All in favor, say aye.
Aye.
Any opposed? So moved. 22,
I move to approve payment of a one-time non-refundable entry fee of $1,000 to join Flimhit Medicare Collective Purchasing Program pursuant to the Flimhit MOU, paragraph 7, item 1.
a second? Is there a second?
I guess I'll
I
say.
believe-
Okay.
I believe I have to abstain.
You do, yes.
Okay,
I'll
so
second.
Kim, second by Kim, discussion.
Well, yeah.
Well, I know that I opposed this before, but I'm just curious, has there been anyone who took advantage of the new?
Yes,
Okay.
three
Three
current
people?
employees, or not employees, current retirees
Oh, this is
took
still.
advantage. This was, you know, we've got to over halfway through the year. So people have mass deductibles that take their contribution to their deductible. So it would have been a loss to several people.
Right.
Now, come the new year, they will move, but, given it was mid-year, it wasn't worth it for those three members. So another three members, I believe it was, agreeable to, so they were very happy to say that.
So we didn't pay $1,000 the last time?
We did not.
Okay.
We didn't pay it because we didn't know who was gonna be in.
Right.
So, the savings was to be $1,000 a month. I believe that's gonna be adjusted because three members didn't move over. So it'll probably be $500 a month savings is what it will be. And, it's still,
Still a positive.
still a positive for the town, because we're talking about the next 5 months. So it's effective August 1st, so.
Do we pay that $1,000 every 6 months or just one time?
One time.
Okay.
Yeah, we pay 1,000 one time and we're saving 500 a month for the next 5 months. So it more than covered the
That's for
$1,000 and we'll really take advantage of it for everybody next year. Because it's improved coverage for them, it's more co-pays and all the way down the line, and it's a savings for the town. No? Yeah.
Yeah,
Oh,
no,
oh.
No, he was answering. I was asking.
Okay. All right,
Shall we vote?
yes, all in favor, say aye.
Aye.
Any opposed?
I'm gonna say no, because I opposed doing this mid-year, so I'm gonna
Okay.
continue with the nay.
Okay, so 3 yeas, 1 nay. 23. All right, I'm gonna skip.
No, you're good.
I'll make a motion to authorize the creation of 2 Town of Mendon email addresses for Climate Smart Communities Task Force members. I'll just stop there.
I'll second it.
Okay, discussion. Most of them, we passed this last month, all of the members of these committees already were included in that, so that's why there's only an addition of 2 more people that are on Climate Smart Task Force for this. So I just wanted to make that clear. All in favor, say aye.
Aye.
Any opposed? So moved. 24.
So we talked a couple times about expanding the Board of Ethics to 5 members from 3. So resolution or item number 24 is I move to propose the drafting of a local law for the year 2026 entitled a local law amending chapter 24 of the town code to increase the membership of the Board of Ethics from 3 to 5 members. And this motion will move to draft the local law and schedule a public hearing to receive public comment prior to any final legislative action or appointment of new members.
Do I have a second?
I'll second.
Okay, discussion.
Thank you, Tanner, for taking the initiative on this. We did also talk about amending other portions. This is specifically section 4 of the Code of Ethics. We also talked about amending some other sections to broaden out and include some behavioral elements. Right now, our Code of Ethics is very focused on fiscal responsibility. Would it be possible, Megan, to also include that language? I didn't have a chance to write it before tonight for the hearing, or does this motion only allow us to
So,
change from 3 to 5?
so for the resolution, I would recommend striking the language section 4 subsection A and just address chapter 24. That would expand our authority to make changes to both section 4 and section.
The rest of it.
I forget what section.
Yeah, whatever section it is.
Two, I think, is what you looked at.
So we could absolutely work that out. A couple
Okay.
timing things that we need to keep in mind. So any post local law needs to what they call age, which means that it needs to be on the board members' desks at least 10 days before any vote. So if you were, say, going to vote immediately after the close of the public hearing, you would need it at least 10 days before that. That being said, it also needs to be published, and I would need to, as I sit here, I don't have the dates for the publication in my head. So I'm gonna say, I think, yes, it shouldn't be a problem if you want to go ahead and schedule it for September.
Mhm.
What is the date of the September meeting? You mentioned that there were two. So one,
14th, I think,
14th and 28th. I
28th.
believe.
okay.
2 weeks apart.
The 28th, is that a regular town board meeting?
No, the
14th is the regular.
14th is regular, 28th is an additional because of the budget.
What I,
The budget.
yeah, what I may recommend, just from a timing perspective, is if we have the public hearing, schedule and have the public hearing in September and address the vote in our October meeting. That way we're not rushed, that way we've got enough time to digest and review all of the public comment and recommendations.
That seems very prudent to me. I would absolutely support that. I think from my position, I just need to know when I can expect to get from you guys what you want to see in the local law so that we can make sure that we meet all the publication requirements. So that when that public hearing happens in September, the public has time to look at the proposed local law.
So would the public hearing be the first or second meeting in September?
Typically, it would be at a regular board meeting,
14th,
which would be the 14th.
and that would open it, and then we would maybe seek to close it on the 28th?
I would, well, it depends. I mean, I would probably close it on the 14th after everyone has had a chance to speak. And then
Okay,
you all can discuss it still,
right.
for as long as you need to after that public hearing.
Entertaining the feedback that we got at the public.
That's exactly. My concern right now is making sure that I have enough time to put the local law together with the language that you guys want in advance of that public hearing, so the public has time to be able to consider it and make thoughtful comments in September.
So then the only other question or piece that I'm struggling with is at what point do other board members have, is it that 10-day window in advance of the hearing that they have an opportunity to maybe to change it, to offer edits and comments? We won't have necessarily met in a workshop format to go through it.
Yeah, so doing it this way by scheduling the public hearing before we have the actual local law is kind of putting the cart before the horse. I mean,
Okay.
there is a way that we can make it work, but if you're anticipating big changes, you might want to workshop that
First.
draft. Exactly.
So then we go back to maybe like, do you feel an urgency around going from 3 to 5 right now? I mean, that's a little easy, quick thing. Is there an
Not,
urgency? Okay,
no.
okay,
I mean, I'd like to get it. I think that it is important. We don't have anything before the Board of Ethics right
Yeah.
now, but there have been challenges in the past whenever items
great.
have come up and somebody has had to recuse themselves and there's issues with quorum for the board. That's the only urgency that I see. I don't see anything on the horizon that.
No.
yeah, no, I
But
agree with that.
that is a very important factor. If something were to come up with only 3 members, there could be some real problems with
Well,
resolve.
we're talking the difference of probably a month,
Yeah. Yeah.
not
Yeah.
many months. And so it's like,
Legal experts.
Yeah, so maybe if you want to get me things, maybe within 2 weeks, I
Yeah.
can put something together. It can be published as part of the packet for the September meeting, and then there could be a separate agenda item just for discussion amongst the board members.
Okay,
At that point, we can figure out what's gonna go to the public, and then in October, you can go ahead and have the public hearing and start your consideration.
and I'll probably use a lot of the language from that handbook that we received from, who is it? Our payroll people,
Complete payroll.
complete payroll. I'll probably just kind of pull for that and maybe some changes. I don't know. I have to look at it, but that's the plan.
So you'll do a draft that we
Yeah,
can all
I just-
review and add comments to for the next meeting.
Yeah, I would have ideally had that for tonight, but the
And-
environmental thing
Well,
got me.
we would give it to Megan to
Yeah.
then review that
Yeah,
for the
okay.
next meeting. Is that enough time?
I would love a week to 10 days to review it, just knowing kind of what my schedule is over the next months. But yeah, also please keep in mind that like my comments today should not in any way discourage you from having individual conversations about things that you would like to see, not a quorum, mind you,
Mhm.
but you can definitely speak to
Email.
each other one-on-one.
Yeah.
About what you would like to see in this law, and then, I mean, that's, as long as it's not a quorum, you guys can talk.
So
Okay.
September 14th is gonna be for discussion, and October will be the local outing.
The public,
the
the
public
public
hearing.
hearing,
Public
Yeah.
hearing.
and then November would be the vote.
Potential.
Well, there's 2 meetings in October also.
Yeah.
So,
If one's for budget, I just based on my experience, I would leave it for budget. Those can get to be pretty long. It's good to
Okay.
have maybe just the budget.
So I lost the bubble. Are we scheduling the hearing?
I will
Yeah.
table this.
Oh, okay.
Yeah.
I'll move to table, item 24.
I'll second it.
okay, any discussion?
We just did.
Yep.
No,
just
yeah,
did
we
that.
did. So, all in favor?
All right,
Aye.
Any opposed? So moved.
thank you.
So we don't need another motion to the next.
That's exactly right. Yeah, yeah. My understanding is that member Cruiser is going to put something together and
Yeah.
perhaps take individual temperature, get something to me that I can then put in the final form and distribute it before the agenda goes out for the September meeting. And then in September, you guys will be in a position
To
to schedule
discuss.
the public discussion
Yeah,
and schedule a
discussion.
public hearing for October.
Okay. Number 25, HUD resolution. I'll make a motion to approve the supervisor, someone else should read this.
Okay, I'll make a motion to approve the supervisor to sign the update for the cooperation agreement for Urban County requalification.
I'll second.
Okay, this is a requirement. Don't really have a choice. But do I have a second?
We did that.
I second it.
Okay,
Yeah.
thank you. Okay, so in discussion, I just want to state that we don't really have a choice, but at the same time, the town of Mendon has benefited from this cooperation. In 2012, the Mendon Library acquired ADA sidewalks, handrails, and curbing at the Mendon Public Library. In 2010, Summel Road soccer fields, we built ADA bathrooms. In 2009, Summel Road Park received an ADA restroom facility. In 2006, Mendon Community Center received ADA improvements. So, given that we have work to be done at the
And it,
community center, maybe we get some help there.
and it looks like we initially entered into this agreement in 2002. And there must be, is this the only update that's ever happened since
It is.
2002?
It
Okay,
is.
so they updated the language,
Right.
they being the county? The county?
Yes.
Yes.
Yeah,
Okay.
Adam Bello has to sign that too.
Updated some language.
Yeah, the original language is 30 pages. It was signed by Lover. Lover. Lower, yeah.
Loberg. Are there any other implications to us that we,
Just taking advantage of the fact that we are legally required to be a member.
oh, we have to be,
Yes.
okay, we can't not be, all right, okay, all right.
Five for grant.
Okay. All right,
Okay, all in favor, say aye.
Aye.
Any opposed? So moved. 26, Copperfield Community Discussion. We have a deadline on this. Now, I don't know how important it is that we meet this 30-day deadline. That's from the announcement, which we got very late coming to us. Supposedly was, I think, brought in around the 22nd, but by the time it traveled through everybody that needed to see it, got to me, it was the 22nd of July, and it was when we got it delivered here, but it didn't, by the time we digest that information, can do anything with it at all, we haven't had any time to do anything with that. So as of yet, we can't have any discussion on this. We can discuss it a little bit here, but I mean, this is a very serious item. So I don't know, do we have any leeway on this 30-day?
So that's a great question. I was just made aware of this through Brooke's email at 3 o'clock today.
Right.
I'm not even certain.
Yeah.
All I know is that the planning board has provided comments. Is there an application before the town board? I don't know how this came about.
No, the village declared themselves lead agency, so we're concerned.
This is about a seeker
Yes,
designation.
yes.
Okay. So I can speak generally. I don't think it's a big deal that there's this 30 days, in part because if the village is going to be doing the zoning and land use approvals, they are going to be the closest ones to the environmental issues. To allow them to do lead agency is to let them do all the work. If you are just an interested or involved agency, which I think is what you are, you still absolutely have the right to provide comment to them. But you're not responsible for actually doing the environmental review work.
Right.
So because it's their responsibility to process these applications, it would be my recommendation. And although I haven't looked at everything, it would be a very unusual circumstance for me not to say this. Let them do it. Would be my recommendation to you.
Without any feedback from us at this point?
Well, the only thing that I believe the only thing that is at issue is who's going to be lead agency. Is this the lead agency notice?
The village declared
Yeah.
themselves.
Okay.
who else might it be if it's not the village?
Well, the concerned agencies would be us, fire
Sure.
department, ambulance corps.
Those are concerned, but who else might possibly be the lead agency?
Any of those people could challenge for lead agency status. It would actually be like an arbitration that goes to the DEC and then the DEC chooses. So my recommendation would be to let the village do it. They're the ones that are gonna know the contours of the project in the best
Yeah.
light. But by letting them be lead agency, you do not forfeit any right you
Okay.
have to provide it.
Okay, thank you. That clarification needed to happen tonight, because all of a sudden I'm feeling all this pressure that we've got to get a response to them in the next 8 days or whatever. And there's no way that's happening.
And I just want to make sure that the town engineer does not disagree.
I'm totally concur with you guys. It makes sense for
Okay.
them to be lead agency because they are the driving force on that.
Okay.
Definitely add all your comments that you want. And
Yes.
their advisory comments too, so you could override your comments, I know. But it's still important to get them your comments and put them on notice.
So we do have minutes from the planning board on August 5th that they requested the town send over as advisory comments.
Yes, I saw those too. And that can absolutely be submitted at any point during the process. It's not necessary that they be submitted within 30 days for the lead agency designation.
So
It's wild, right? It's a lot of-
So I did share some comments regarding the Copperfield proposal. Are we as a board gonna write a letter to send to the village, or is the planning board taking that information that was present, how?
So,
do we-
so the planning board views the board as an advisory tool for the town council. So their comments were to us, and their request, their ask was if the board could consolidate and make either a statement or individual statements to the Village of Honey Falls and reference or incorporate any of the points that they made.
Yeah, then we might have some other
So
concerns we want to add.
We will.
Yep.
Yeah, I was gonna say, I think I shared all my points with everybody, so.
I believe the board decision is, do we want to make a board decision, or do we want to have individuals of the board provide response to the village? Does that make sense, the difference?
And I don't think that needs to be decided tonight, because again, the 30 days is just for the agency. I think too, there'll be several opportunities for you to provide input
Okay.
along the process. Tom, am I right? It's just getting started? Okay.
Well, I personally would like a town response.
Yes.
Right,
We
I
didn't
agree.
quite have that with the urgent care. We had great response. You guys did great, like awesome work, but I didn't get to be a part of it. And I might have gotten the environmental stuff in there sooner.
Do you
Um,
and Kim want to take lead on drafting the initial statement? We can review it and I'll volunteer people.
Good start.
You have a very good start. I know you've already.
Your concerns if they're different than mine, and we'll put it together.
Where did this, what is this?
Joe can't do that.
I would say also that we.
Yeah, I just, yeah.
It's all on YouTube now forever.
We just put in the planning board concern
Right,
with my concerns, and then
Yeah.
you guys
Exactly.
feed me what your concerns are.
we can have a special meeting.
We'll do it.
To pull up our.
Sure, we love to be here.
We love it.
Yeah, I know, we're gonna put quarters, get rid of the court and have sleeping quarters. So,
Quarters?
it maybe, a group, a meeting,
Okay.
including someone from the planning board. But, we'll figure it out. We don't have to decide it tonight, so thank you.
Yeah, we've got concerns from the planning board.
Yes.
Yes, we do.
Yes.
We do.
Incorporate those in the
Yeah,
Yeah, I'll
Yeah.
put
other
them
concerns.
together, yeah.
Maybe we could get the ECB to weigh in too, maybe even the H.
hey,
AC.
the urgent care was a driveway, this is a whole different thing.
Oh, yeah, this is a
Times
lot.
20.
Yeah.
That
Yeah.
maybe-
400.
Like 400.
But will they acknowledge our concerns?
All right. Well, on the same topic, I would like to say that most of this work tonight on your behalf is while you were traveling on an airplane back here. And I really appreciate your diligence and commitment, and I know that's a personal commitment right there to offer that to our town. So thank you.
I second that.
Thank you.
And Mike Burke from the ECB has commented on Zoom here, saying, what about involving the Mendon ECB?
That's
I
what,
think,
yeah.
I think,
Yeah.
Tell Mike
Yeah.
wherever the camera is.
Like mind melding
Yeah.
through the airway. Okay, well, public comment. Whoa,
Mo Bigby, 7 Seville Lane, Honey Falls. Two comments. First one, conservation easement is a great idea. If there is adequate and appropriate testing for that green space. I don't trust, based on the stuff that I've seen, that that's been done yet. So please, your board, be mindful of that. And if you're gonna go and accept that conservation easement, do it with that knowledge. Right? That's the first one. The second one, let's see if I can remember what it was.
while you think about it, I'll
Yeah,
add that our
yeah,
children
go
will
ahead.
be playing on that green space, our community will be on that green space. So we need to know what's underneath.
Pete Doyle, 271 Sibley Road. Two comments to kind of follow along with what Mo said there. Regards to the urgent care. Buffy and I consulted, and we've been around town for a couple of weeks. So our thought is the concern about the contaminated soil and that part of it, that should have fallen in when the car dealership went out, property got transferred to, I don't know, Chen's or whatever it was way back. Did Margot even send us stuff like that? And then to the village. So to me, the liability for that contamination or the concern about the contaminated soil should have fallen all on them. I don't really think the town really should have, really should be that concerned over what's going on
Yeah,
as far as that. I think the town's concern is the access through the driveway and that accessibility, the maintenance, things like that, and wear and tear on a road versus, you know.
Well, in terms of who
contaminated
pays.
property.
In terms of who pays, you're talking about.
Right.
Well, if that documentation
I-
exists somewhere, then we.
I'd recommend we, if we take it after the meeting, but.
Yeah, good idea.
Right.
Yeah.
So that car dealership has been gone since the late fifties. So if there's any contaminated soil, it should have been discovered way before today.
I just don't want a bunch of kids playing on contaminated soil.
Right, which that's where they have their story time now.
Right,
So,
I don't wanna kill kids.
Right, so, okay, my other concern is over the healthcare presentation there. I really, I'm having a tough time with it. I think the plan to have a one plan fits all type mentality for this. You know, I got guys working for me that are in their, you know, early to mid twenties, to guys that are 63. How can we have a one plan, singular plan that's gonna fit the needs of everybody, so that everybody has an equal option
Yeah.
on this? The other thing that I noticed too was the co-pays were significant. You know, I mean, I don't know, I pay like $25 for my co-pays, but to pay $70 for a co-pay for urgent care, because you can't get into a doctor's office, you can't go see your primary care physician, so you have to go to urgent care. So that kind of put, you know, maybe it is, you know, to pay $25 versus paying $70. To me, that's significant, so. Then the other comment that I really caught was, if we did go have multiple plans or multiple options to go union versus non-union and be able to negotiate in a union contract, doesn't really resolve anything for us, so. That's kind of what I took out of that too. So I know what direction my vote is, but we'll certainly look at the other options that we have with Don Brown and stuff like that. So,
Thank you.
that's what I got.
Oh, you thought of it.
I remember the second thing, when you're taking a look at the, ethics committee, get a hold of the resolution that was passed for policy procedure back in, 24 by the previous board. And you can incorporate a lot of that material into the law.
Thank you.
Buffy?
Yes, Buffy Mydensall, 2 Rittenhouse Drive, Grand Falls. Couple weeks here.
She could point out, she was telling me back here. It's in regard to the existing fire hall and the property that adjoins Critics.
Yes. Back when Critics was purchased by Dimitri Kokinis and John Rozakis, they were talking with the village at the time, and I happened to be mayor then, about access from Monroe Street for people who were used to walking off Monroe Street coming to the restaurant. So the village granted an easement or right of way, I don't remember now because it's been a long time, from Monroe Street next to the firehouse back to the restaurant property so that people could walk through there. Now, when the village took ownership of Critics, there were several tax parcels involved, and I don't know if they consolidated them all in one or what they did. But this was relatively flat, and it would give kids on bicycles or people walking from a residential area through here, that was 111.5 feet
Yeah.
of easement to the critics' property. Would also give a safe passage, as you were expressing, back to the library.
Yep, right to the main entrance.
With
Yeah.
that being the title stuff that we got today,
That-
it was a lot. I
Yeah.
didn't have time to look through it.
But
It should be.
it
Yeah.
should be. The other thing that would present as an option to eliminate or add, either eliminate the parking that you had offered at the library for
Right here.
employees, or
Hmm.
add to that option for parking to the village parking lot, the municipal lot across the street from the firehouse. Now, the village would be responsible. They plow it now. It
Yeah.
wouldn't be any added.
Well, isn't there village parking around the gazebo too? Like
Sure.
Yeah,
that little
but-
horseshoe?
but this is
Yeah.
maybe a better way for the town to not take on so much by letting, if this is, the village wants this because they own it, they want to sell it on, obviously, they want to sell it, to have the parking for those however many spots.
8 spaces.
8 spaces over here. In
Good
lieu
suggestion.
of bringing it to the library, it would take 8 more cars out of that driveway situation. And it would already be village controlled, village maintained, and it's employees that are going to work on village sold property.
And there's
So-
rear entrances to the urgent care right off of that sidewalk
Well,
area.
yeah, there could be an employee entrance on that
Right.
side of
There
the
is
building.
one there, so on the, I believe you could see it.
Right now, one issue is they have the fire station has a generator here,
Oh,
which.
Well,
I might be
But that's
thinking.
not, that can get moved, that
it
can
can be
get
moved.
Yes.
I mean, again, it's a village owned property, so.
There's no crosswalk.
No,
So they would have.
Let's lower
And
it down.
there's
So
library hours and
somehow they could get in through here on the side, maybe, right, up along
Yeah.
the building, there's their dumpster enclosure here, but that doesn't mean that
It is.
this isn't. at
Oh,
the
for the
same
urgent
rate.
care building.
Yeah, they could come along here potentially.
Plus, there's an
There's a whole
access
Sidewalk out to Monroe.
from the library
About
up to Monroe
Right to
Street.
Monroe Street. yeah.
We don't
To
have
give
a
that
block.
face. They say
So,
face.
but that might help the employee parking situation
Yeah.
as well as
Yeah.
a level spot.
We were thinking about that also in terms of, during construction with limited access, through the main driveway to the library. People could park on Monroe Street or in that village parking lot, so you have, be able to access the library.
They can also, right now, walk to the library.
Right.
But this would be
Yeah, another
way or help with the parking.
Right.
When we first were on site here too, we saw a number of people parking here and the apartments. And whether they
Yeah,
were
where
sharing
do
that
they
or using that, or where do they park?
Oh,
And that
yeah.
may be shared or maybe in some of these title agreements or easements.
One of those people parking there on a routine basis commented on social media about the hardship it's gonna provide for them. To lose that parking spot. I think they must live in an apartment right there. But hey, it takes a village, thank you.
It's the little things.
So,
I have one more public comment on Zoom.
okay.
Here we got Danny.
Oh, okay. So Mike Burke again says FWIW, whatever that means to the
For what
kids
it's worth.
nowadays. Okay.
What
The
does that stand for?
Copperfield project has been underway for 2+ years.
What it's-
Getting squeezed into a 30-day response period puts the town of Mendon in a tough spot.
Mhm.
That's all I have to say.
Thank you, Mike.
Danny?
So we heard some interesting details about the old critics property. Sometimes details are lost to history. A few months ago, the library was upset because they didn't own the grass. You're considering a scenario where you still don't own the grass. Who knows what the future will bring? You don't own it. Just for consideration.
Thank you.
Thank you.
Thank you.
And if Michelle had the
Okay.
asset, you know,
I know where you are.
Okay. Anyone else for public comment?
I make
Okay.
a motion to adjourn.
Second. All in favor, say aye.
Aye.
Bye.
This, go down as the longest meeting ever, or?
No,
I-
no, not even
I
close.
promised
Okay.
Tom that I would keep him here until past 11,